Hi, my name is Courtney Ball, and I'm doing my formal evidence-based practice presentation. I wanted to let you all know I chose this topic because I started off on the oncology unit as a first-year nursing student, or excuse me, nurse after graduation. And I really wanted to know how to give the best shift report. So as a new grad, I started off on the oncology unit where my manager wanted all of us to do bedside shift report. In doing so, there was a little bit of hesitation for all of us to do so because we didn't know if the patients were going to be uncomfortable and if we were going to be uncomfortable. So I really wanted to do a little bit of research to see how, in fact, that patient outcomes and nursing outcomes. So my PICA question is, among staff nurses on a med-surgical unit, does implementing bedside shift report lead to a greater satisfaction with care when compared to traditional shift change reports at the nursing station? So I began my search with a couple different databases. One was a health and nursing, the second was Medline, and then the third was Sinhal, as well as the Nursing Allied Health Source, ProQuest. How I retrieved these, I just went to the library on the college website, and then I typed in what I wanted as far as limitations. And the majority of them were English, full text, and 7 years date of publication. And then I would type in keywords such as nursing handoff reports, as well as bedside nursing. So that's how I kind of got to my range of articles that I was able to choose from. All right, so the very first article that I chose, it's called A Quantitative Assessment of Patient and Nurse Outcomes of Bedside Nursing Report Implementation. And I really chose that because the study was conducted on 7 different medical surge units in a university hospital. The second one that I chose was a systematic review on the transfer of information during nurse transition in care. And I chose that one because they reviewed over 125 qualitative studies, and I thought by having that many studies, it would have given me great information. And then the third one I chose, it's called Bedside Shift-to-Shift Nursing Report Implementation and Outcomes. And I really chose this one because the author wrote how sentinel events were happening due to poor handoff procedures. Now, the very first critique, a quantitative assessment, as you see on the screen right now, I really wanted I read this and chose it because in the results, the nursing perceptions improved in patient safety, involvement of care, but the perceptions were negative in that nurses thought it took too much time, even though the overtime was decreased. The strengths in this particular article proved that the patient falls decreased at the time of shift change. And then the limitations to this article, the sampling size was a convenient sampling, and that was not a good representation of the nurse and patient representation. And also for this particular article, the study, the nurses were allowed to submit what they thought through via computer, and in doing so there were no identification markers. And so the study was, the limitations are that one nurse could have given many different different views. So that was the kind of limitation there. The second article, A Systematic Review on the Transfer of Information During Nurse Transition and Care, was quite interesting because this was a quantitative study. It was done over the course of 1988 to 2012, and over 800 nursing handoffs and 300 nursing interviews were examined. This was interesting because 70% of the data conveyed during handoff had a corresponding document source. Once the items deemed irrelevant at direct patient care removed, then the percentage increased to 93.5%. The findings clearly shows we need a standardization to improve safety and quality, and that is front and center. The strengths to this particular article, it's a level 2 evidence, meaning it's very high quality. It was a high quality study, but the limitations is that it's not current, up-to-date time. It was done between 1988 and 2012, so that could have been, it's just not current evidence-based practice. All right, and then the last article, Bedside Shift-to-Shift Nursing Report, Implementation and Outcomes. This was a good article because the study was conducted in a university hospital. It was 32 beds on the unit, but only 8 were implemented within this study. It was quite interesting though, because the results showed that the average report time was decreased from 45 minutes to 29 minutes when the nurses gave bedside shift report, and the nurse satisfaction improved as well. And the strengths to this, it showed patient and nurses positive outcome, but the limitations were it was only 8 beds. All right, implications for nursing practice. By standardizing shift report techniques, we can improve outcomes. By giving shift report at bedside, we could receive a much more accurate handoff without distractions, and we could really assess the patient and the area which the patient resides. By giving shift report, we also could lead to decreased fall times right at shift report change. Some of the limitations, though, is that the nurses, it would be hard to implement this new change because nurses are so used to giving report at the nurses station. I hope you all enjoyed this, and it was a wonderful presentation. I thoroughly enjoyed the research, and I found it quite educational. All right, thank you so much.